You're live, Mr. Harding.
Good afternoon, parents and carers. Just like to start by saying that we've set up this meeting to explain about how we can provide further support for your child at this uniquely upsetting time. And it goes without saying that we'd like to start by offering our condolences to all of Isaiah's family and to all the friends and staff who are missing Isaiah, which is a unique testament to Isaiah's popularity. Just to let you know that in the announcement section of the Q&A, which will be operating throughout today's discussion, we've put details of the GoFundMe page, which has already surpassed £18,000. So we're very grateful to all those parents who've already supported that GoFundMe page. We've also put in the key email address for seeking for additional support from Kingsdale, which is support@kingsdale.southwark.sch.uk. And as I say, those are in the Q&A section of this discussion. I'd like also to thank the parents who've been so instrumental in shaping the school's response and ensuring that we've been informed by best practice. And I'd like to pay tribute to our remarkable students who've supported each other. And although we've been taken back by the maturity displayed by the students, we're nonetheless aware that the impact of this traumatic bereavement makes them particularly vulnerable. And it's for this reason that we're profoundly grateful to Dr. Jessica Richardson and her team for giving up their time at such short notice to share her expertise. I'll now hand over to Mr. Sear, who will introduce the part of the visitors. Thank you, Mr. Sear.
Thank you, Mr. Harding. And I would just like to start by echoing those words of Mr. Harding and just extend my thanks and the thanks of the governors and also the school management and the teachers to the parents who have been so supportive at this very difficult time for the school community. It is a uniquely difficult time for us all, and the words of sort of support and love essentially that we've been getting from our school community have really helped, I think, the staff to work through this and try to support the students as the best as we possibly can, which is what we've been doing. We're very, very pleased today to be able to welcome Dr. Jess Richardson and her team to this talk. We think it will be very useful for you to hear over this holiday period and beyond as to how we can support our young people at this very difficult time. So without any further ado, I shall hand you over to Dr. Jess Richardson. Jess, over to you.
Hello there. Thank you for having me today to talk about trauma and reactions after your very difficult experience individually and as a school. Just to introduce myself first and my colleagues, and then I'll share some slides. I'm Dr. Jess Richardson. I'm a consultant clinical psychologist at the Trauma, Anxiety and Depression Clinic at the Maudsley, which is South London, and Maudsley NHS Foundation Trust. I'm also one of the co-directors of the Children and Young People's Psychological Trainings at King's College London, and I'm pleased to be here with you today. I'll just introduce my colleagues first. So just introducing first of all Sarah.
Hello, I'm Sarah Miles. I'm also a clinical psychologist working with Jess at the Trauma, Anxiety and Depression Clinic.
And Susie as well, could we just introduce?
Hi there, my name's Susie Lanyardo Avebrook. I'm a whole school approach lead for the mental health support team that works in Kingsdale on a weekly basis.
I'm now going to share some slides, and the process today is that I'll share some slides. The chat will be open. My colleague Sarah will be just looking at themes of some of your questions that are coming up. I imagine some questions might be quite similar, some might be different. And at the end, we'll have a chance to kind of run through some of our responses to some of your questions. And Sarah might also write some things in the chat as well. If anything is very personal in content, just to let you know, we might not kind of respond in that moment, and we could respond after the webinar. Okay, let me try and share my slides. Hopefully you can all see that. Yeah. So this is just to really think about supporting your child. So in this webinar, the plan is for us to think about normal reactions after a traumatic event, to think about communicating with your child about what happened, how to do that, to really think about some of those recovery principles to put in place, and how you can look after yourself as well within all of this. And then at the end, we'll think a little bit about who might need some more help. So just in terms of acknowledgements, you've already met my colleague Sarah. Here are some of my other colleagues, and just it's always important, I think, to give acknowledgements because some of these slides are kind of supported by some of these organisations, or from the South West London Trust, Annika Clark, and UK Trauma Council have got excellent resources. David Trickey has done lots of work in this area, and that's a good book if anyone did want to read a little bit more at some point, which came out last year. So first of all, just to kind of just think about, you know, what actually is trauma before we do any more. I know you've all just been through one, and I'm sure you understand what that means, but just to kind of really clarify, this is something where there's an actual or kind of threatened death, and obviously in this case there was a death, as we know, or serious injury or violence, and that might be kind of directly experienced, witnessed, or even learning about the exposure of someone close. And generally with a trauma, people might feel helpless. There might be really intense kind of sensory experiences. So sight, sound, smells, taste all become really quite exaggerated. And so, you know, for your children, things they might have, you know, heard if they were at Beckenham Place Park at the time, or they might not have been, of course, I realise that, you know, certain sounds and kind of experiences can be heightened. It's often very scary and overwhelming, and a real sense of being kind of out of control and quite sudden, which I know this was. So just to say, there's a lot of normal human behaviour after a trauma, and predominantly, not for all of you, I know on the call, because you'll all have different experiences, but predominantly, you know, a lot of it is just very normal at the moment. When someone's experienced a trauma, it's very normal to feel shock or to feel numb or fear, despair, kind of sense of grief and sadness, anger, confusion, mistrust, restless. These are all just extremely normal. And it's also really normal that people don't want to talk about it because, of course, it's extremely painful. Sometimes people can't quite make sense of it, don't have the words maybe, or the concepts to express those feelings. It might feel contradictory. You know, they might have confusing thoughts, you know, maybe even blaming thoughts or guilt or confusion, and they might even be, you know, anxious about whether they're going to be heard or even lose control. These are all common. This is a really good resource after the event by David Trickey, who, as I said, has done lots in this area. And these are just really things that are just, again, you know, really common after an event like you know, your children have been through. So having nightmares, memories or pictures of the event unexpectedly popping into the mind, feeling as if it's happening again, drawing about it, or, you know, for younger children, they might be playing about it all the time, not wanting to think or talk about the event, avoiding anything that might remind them of it, and getting kind of quite angry, worried or upset quite easily. And of course, not being able to concentrate, which I know is a big one at the moment for the GCSE children, not being able to sleep, feeling quite nervous, jumpy, and really on the lookout for danger, maybe wanting to be with parents more. That can particularly be the case more for younger children, or kind of a fear of them dying. Even physical complaints can be more common, and, you know, problems at school and feeling more withdrawn. So these are kind of fairly common things initially. Obviously, the concern is when they kind of are around for a bit longer. But, you know, if any of your children are experiencing any of these at the moment, it's not unusual. And just to really start out by saying, exposure to trauma is actually unfortunately very common. So there's a really excellent paper written by one of our colleagues, Steph Lewis, which is a kind of UK longitudinal twin study with 2,063 young people, and it really looked at the kind of course of trauma, and really what this shows is that about 31% of young people by the time they're 18 will have experienced a trauma of some sort, but actually only 8% will develop post-traumatic stress disorder. We'll talk about what that means in a minute, but it's much of the symptoms I just shared before, but you know, that would go on for longer. So actually, most people, whilst trauma is common, actually developing PTSD is far less common. We also know that kind of the age of trauma, sadly, is very often kind of for those adolescent age group. You can see the peak here in the graph. It's really common because obviously from a kind of biological and social and, there's lots of vulnerabilities, of course, and traumas are more common at this age, sadly. It's really important to be aware that, on this call here, your children will all be managing this, as will you, in extremely different ways. They might even have not been directly involved at all, but it can still have a significant impact on them. People react differently, and I guess a really key message today is that's okay. We don't have to react the same. It doesn't mean that, people don't care. If they react differently, it is okay to react in all sorts of different ways. And it's normal as well to have a mix of feelings that can come and go in waves as well. And of course, personal experience and the impact can be really mediated by a person's own history. They may have had obviously their own kind of previous traumas, even, their family, their culture, religion, all of these things, of course, impact on how someone might experience a trauma. And this is a shared trauma. And within that, there was a group of young people I know who were in Beckenham Place Park where it happened, but also there's lots of people who would have been connected to Isaiah and lots of people who knew him in different ways. So there's going to be a considerable varied reactions here. People might feel they might feel okay, actually, but they may feel really bad that, they feel that way. They might feel they should be responding in a certain way. They might feel there's something wrong with them for acting this way. And just really to reiterate that point, there's not a right way to kind of react and respond. Sometimes people feel that they can only really share with people who've also been through this. And I know I've heard that there's lots of young people kind of going down to the lake together, and we can talk a bit about that maybe later. But it's common to kind of want to kind of share that when it's been a shared trauma like that. Now, with these different reactions, some young people, will not experience any difficulties at all. Probably generally, I'm not saying this will be exactly the case for your population, but generally about half don't experience difficulties. Some do immediately afterwards, but these diminish over time, a few days or a week. That's about a third, roughly. And then some young people seem to be unaffected maybe to start, but later the difficulties emerge, or they may have difficulties directly after, and that kind of persists over time, and that might be 10 to 20%. And just to say, that doesn't mean that they would have post-traumatic stress disorder. It's actually much more common after a trauma to kind of experience depression and anxiety and maybe cope with drugs or alcohol or other things. So actually there's often more common other things that happen after a trauma, even more than PTSD. So whilst looking out for post-traumatic stress disorder is important, actually, it's actually more common that a child might be feeling a bit depressed or other symptoms. So how do you speak to your child about their reaction? And that's important. A key message is not to avoid that. Avoidance, unfortunately, is a natural thing to do, but unfortunately does make it worse. So these are the things we would say, how to give space to talk about this, how to validate them, how to give information, how to speak honestly, how to normalise, and how to model it. So let's go through each. So in terms of space, do make space and time to talk about what's happening. There's different ways of doing that. You might want to kind of agree a time, or you kind of, it might be something that happens naturally. But you want to kind of make it really clear that what's going on for them, is important, and you're there to listen. And they might struggle to express that, and you might need to kind of ask questions, and asking open questions can help and kind of clarify, how does this make you feel? What do you want to know about this? Is there questions you've got? And just really helping to kind of open up some of those conversations. Find a time that works for them, not just what works for you. You know, you may be busy parents, I don't know, and you know, it can be hard to find the time, but really think about what's going to work for them. And it might not be the right time for them, and respect that. Respect they might want to be silent. You know, you can check in at another time. So what you don't want to do is kind of go along with the avoidance, but at the same time, you're not trying to make them talk. You're not trying to kind of really kind of force them into a position where they don't feel comfortable either. So it's really getting that right balance and just not rushing in with your views, but really that really active listening is really key at the moment. And then you want to make sure these are things I'm sure you might do anyway, but you know, just to really reiterate, these are kind of the things we know that help at a time like this. So validation and normalization. So just if you kind of look on the side here, this is from some colleagues who say it's quite normal to be upset, even for quite a while after a frightening event. Children, young people and adults may feel angry, sad, guilty, confused, or any combination of feelings. Some people continue to feel scared, even though the danger's past. Children and young people worry less if you can help them to see that their reactions are normal and understandable. So let them know it's okay. You know, avoid saying things like, don't worry about that, don't think about that, let's, you know, move on, don't be silly. Really kind of validate what they're bringing to you, even if it does seem, you know, something that you don't agree with. Just kind of validate that to start with. Let them know that, you know, you can understand why they might feel those ways. You know, they might even, depending on the child, depending what their experience was, they might even feel blame or responsibility or any of those sorts of things, or they might not. And of course, that's also fine, just again to reiterate that. But help them just to see that, you know, the difficult feelings are a response to the situation, and they're very normal. So do give information, do be honest. You know, be prepared for questions. I know the school will be answering a lot of questions as well, but it's reassuring if, you know, as parents, you can have some idea of what's going on. And do be honest, you won't have all the answers. There is uncertainty, and there's a lot of uncertainty, I know, about, you know, what happened, and that's okay as well. You know, you can't give certainty when there's not, so you can be with that, but it's just allowing that, really. And do model you know, yourself, even if you're nervous. It's really important not to transmit that to your child and overburden them with your feelings. So, you know, you're bound to be having a lot of feelings right now, but just think about how much you're sharing with your child. It's okay for them to know that, you know, you're finding it hard too, but just be aware of how much you're burdening them. And just try to maintain a kind of calm tone when talking about what's happened. There's no point kind of saying that there's nothing to worry about if you're showing them the opposite in the way that you're behaving. So they're just key ways to kind of have those conversations. Do talk about how they're reacting and how it's affecting them. Now, these are some recovery principles that we think are really important. These principles are going to be important in your school. They're going to be important for the young people, and they're going to be important for you as parents. So, you know, they're quite easy to remember: safe, calm, connected, in control, and hopeful. And so we're just going to go through each now and how that could apply. So first of all, feeling safe. This is the actual safety as well as that felt sense of safety. So one thing we really do know is that actually keeping routine, structure and predictability is really important right now. So when someone's experienced something very unpredictable and scary, actually it's a kind of normal to kind of think, oh, just let them be. Let's just kind of, they don't need to kind of, I don't know, do the dishwasher or whatever chores or get up and do this. And actually keeping things the same is extremely helpful and important as far as possible. So do kind of keep the routines that they do around the house. I know they're on holidays at the moment. Do keep the structure where possible, as much as you can, being the Easter holidays. By that, I mean even small things, getting up, you know, having food together, going out the house, you know, all these things, getting dressed, seeing people, you know, these kind of, you know, routines as well. And the revision, I understand, will be on lots of people's minds. And I would say that for actually keeping that routine is important as well. Now, of course, there'll be a small percentage of children, I realise, who will be really struggling with that, and that may feel a bit different, but for most children, I would say they will need to keep revising. They might be struggling to concentrate. Do give them regular breaks. Think about what rewards, you know, they might kind of want in place, if that helps to kind of encourage them, whether it might be going out for, I don't know, seeing their friends or whatever that might be. It doesn't have to be something that costs money, of course. But where possible, keep that going. But just be aware they might be struggling to concentrate. But I wouldn't be advising not revising unless they really are extremely struggling, and that might be different. But I think for most children, we would say keep that routine. And feeling safe links to kind of making sense of what happens. So a big thing is the making sense. In fact, this is one of the things that gets quite stuck if someone kind of develops more kind of severe symptoms, that the kind of the meaning they have made of what happened can get really difficult for them. And how someone makes sense of what happened is impacted by how others react. And of course, we're all reacting in different ways. You know, all of their friends might be reacting in different ways to them, and that's okay. But you as parents have got a role to support them to understand what happened and help them to kind of have a balanced way of thinking where possible. So validate them with what they're bringing. You know, I can hear that sounds really difficult, and maybe ask them questions that open up their thinking a little bit to kind of maybe loosen maybe a bit of the rigidity around a belief about, for example, guilt or responsibility or kind of anger or whatever that is, or the way other people are reacting, just to help them think, just to create a bit more of that balance. Can be a really helpful role you can have to create safety. And then the big one, social media and phones. So of course they're of an age where I'm sure they're all on their phones a lot. I'm sure they're all looking at every TikTok video, maybe about what happened and related content. And this will impact on their sense of safety. The more they read, of course, the algorithms, how it works on social media, the more they will get that content coming up on their feed. The more they look at that content related to what happened, the more likely they are to feel quite, you know, anxious or kind of sad or angry. Now, I'm not saying, therefore, you know, take away their phones. They're 15, 16. I understand that's, you know, extremely difficult to do. But it's really worth having conversations with your children to think about the impact of the social media, the impact of how they're talking to others, the WhatsApp groups or Snapchat or whatever, how they're responding to each other, how that might make each other feel, and how much they should or shouldn't kind of go on various platforms. And I realise you may have little control over that, but it's something to have kind of transparent conversations about and understand the impact and how that might make them feel not so safe at the moment. Calm is the next recovery principle. Give your child space to just experience whatever they are. They might feel happy one moment and sad the next moment. Children are often very much in the moment. That's a wonderful thing. And so just really enabling them to have that experience as well, to be with whatever feelings they have at the time. Think about kind of practical strategies also that can help, such as relaxation. There can be calming apps, or where the kind of breathing apps they might have on their phone, or music, going to the gym. Just think about what's going to help them to feel calm at this time. And of course, I know that the school have made it very clear there's kind of support available if people need it. Staying connected right now is also important. So we've got safe, calm, connected. Support them to stay connected. Help them to go out with family or friends. Keep that as a priority at this time, because getting more isolated and more withdrawn can be more of a risk factor. So make sure that's kind of really, even though they're revising, I'm sure, and lots of things are going on, make sure they're still able to feel connected. They might want to remember what's happened this last week alone or collectively, and there's not kind of one right way to do this. So safe, calm, connected, and then in control. So after a trauma, it's normal to feel that you have no control over what happens around you, and you know, even some responsibility, even if you had none. Just continue to support them kind of having as much independence and giving them choices where possible, with of course the appropriate boundaries needed for their age. And just really giving them the message that you believe in them, really giving that kind of sense of control to them is important. And then lastly, so we've got safe, calm, connected, in control and hopeful. It's a funny one to say hopeful at such a time as this, isn't it? But we know that actually better recovery does happen if there is some hope. And this is dependent on their meaning of the event. So really kind of helping them to have some hope at this time is important. This is not to invalidate the severity of what they have experienced in any way, but offer hope about how you'll get through this together. And support them to think about their plans in 2 weeks' time or a year, and you know, how you can kind of build those feelings of hope. Now, I realise for some children, you know, a lot of these things might not even apply because they're doing okay. And just to again reinforce that's okay, that's a wonderful thing, that's a good thing. And it's going to be hard for children to realise that not everyone will react in the same way. There'll be very different feelings and emotions, and partly it'll be talking to your child about how can they sit with that as well, that, you know, there might be different responses and how together they might kind of have some hope in this kind of difficult situation. So a question is, what doesn't help? There are things that don't help, unfortunately. So dismissing their worries isn't helpful. Avoiding talking about what happened isn't helpful. Blaming your child, we know, does link with kind of more kind of symptoms kind of continuing. So that doesn't help. Being overly protective also doesn't help, or making them feel disempowered, and being inconsistent. So just be really aware of these responses. Unfortunately, we do know that the family factors of how kind of a child is supported can have an influence on the kind of the kind of ongoing symptoms. And so really, you know, just being with your child and just enabling them to talk, not forcing them, but just not blaming, just being there for them is really the most important thing at the moment. But within all of that, we want to make sure you look after yourself. Your well-being is important to their recovery. And so all those principles we just talked about, think how they apply to you. What do you need to kind of be safe at the moment? What do you need to kind of feel calm? What do you need in your life to kind of make you feel better? Do you need to kind of, I don't know, what it might be, going on a walk or being with some friends or with family, you know, being connected? Is there any way you can make yourself have more kind of sense of feeling control and hope? So just think about that for yourself as well. And just take a moment to breathe first yourself. You know, you need to feel calm to calm your child. So just make sure you're kind of doing that for yourself. Find people you can speak to about what's going on with your child as well. That's going to be important. And a big one, be aware of your own social media and WhatsApp use and the impact on yourself and others. The need for sensitivity, I think, is important right now. WhatsApp chats, especially after shared trauma, can really, you know, there can be a lot of content, and obviously it's people trying to work that out together, and how to also getting support with people that understand, but also be aware that, again, everyone will have different reactions there, and some people will be finding that very hard, some people will be finding that easier, and those things are normal. So just be sensitive about what you're putting on WhatsApp, and be sensitive as well about whether you need to even mute it for yourself if you need a space from it too. Think about what's going to be appropriate, not just for yourself, but also for other people right now. So now we're just coming to think about who might need more help though. And as I said at the beginning, a lot of people will not need help, and actually we know from kind of evidence rushing in, certainly kind of debriefing straight after a trauma, we know is not helpful. So it's kind of really, you know, actually watching and waiting is really the most important thing, because the good news is that, you know, most people are resilient, most people recover naturally. If people aren't by kind of 6 months, that's certainly more concerning, and they almost definitely would need help. You might be spotting things much sooner than that, and we want to kind of, certainly within a month, if people are struggling, you know, we'll think about what to do with those people. But a lot of people there'll be a natural recovery and a natural resilience. People who might need more help might be those who are more impacted by the event, where their routine is most disrupted. They might have previous traumas or pre-existing mental health problems, or special educational needs, or difficulty processing, or more isolated, or you know, more quiet, or an overestimated kind of risk to self. So these people are, you know, if you have a child in any of these categories, it's important to be aware, but it doesn't also mean that they are going to need help. It doesn't mean that at all. It just means that you want to just be kind of watching and just kind of aware if more help's needed, but not to panic, because most people won't need that. And of course, this level of difficulty. So, you know, it's the severity, the duration, the frequency, are things changing, the impact, the persistence. So to start with, we're at very early days, but, you know, if these things persist, if the impact is very big, if, you know, it's, you know, their symptoms are frequent and kind of very severe, then of course, these children are going to need more help. I don't want to go into this in too much detail, because this is, of course, not likely for most people at all. We said 8%, the overall population, not even 8% here. So it's really, you know, it's more unusual for sure. And like I say, it'd be more that you'd be looking at low mood and anxiety and things like that. But this is just very, you know, these are the main things with PTSD, that people might have intrusions, kind of memories that pop up, nightmares, might want to avoid thinking about it, have some kind of difficult thoughts, that means cognitions and mood, which can be difficult, and real kind of arousal and reactivity, like irritability, even recklessness, concentration problems. And it would be for more than a month, and really clinically significant distress. So just to note that that won't be most people. But if you are worried, do speak to a trusted school teacher, do speak to the school counsellor or the mental health support team. Susie's here. Do speak to your GP, and school have contact details for CAMHS as well if further support is required. So just make sure you're kind of getting in touch. But again, at this point, you know, a lot will be very normal. In terms of just going forward, and I'm just saying not now, because, you know, these things right now, I think people are in shock. You know, there's a lot of just very kind of difficult emotions people may be managing collectively. And so these are more things down the line. But, you know, obviously key dates such as the prom and the anniversary, and there might be other things that really trigger distress for this year group. And more support may be needed at these times. And in time, you might want to be thinking about memorial services or events that really can kind of bring people together, a real connection, and even kind of, you know, permanent features like a tree. This is a tree actually that my brother died, you know, and I remember the school planted this tree, and look how beautiful it is. And, you know, a bench plaque. There's lots of things that can be a very powerful way to respect and to remember Isaiah. So just key messages really are, you know, many children feel upset for days and weeks after a frightening and sad event. They may show this in many ways. Over time, most become happier and more confident again. Familiarity and natural relationships and routines are key at such times as this. It's important not to rush the very normal feelings and processes we experience after a death. And some, of course, some young people will need additional support, but at first it's kind of most important just to increase that sense of normality, and be with natural supporters, friends and family at this time. These are some resources. These are some videos, Keep Cool videos on sadness, anxiety and anger that people from our team have made in kind of collaboration with young people. There's a video on what is PTSD and animation. There's another animation with a company called Nip in the Bud if you want to find out a bit more. These are organisations around bereavement and loss, and generally to do with children's mental health if you do want any more help. So we're now into just seeing if there's any questions that have arisen. Sarah, you have been looking at the chat. I haven't, obviously. Yeah. Is it possible for Sarah to come onto the screen as well?
Okay, so we have had a couple of themes around young people not wanting to talk about what happened and how much to approach asking them to talk about it.
Do you want to say anything, Sarah, or do you want me to? I don't mind.
Yeah, so I think this has been covered a bit in what Jess has said, so it might be that those who ask the questions feel like it's been answered in the slides, but I think just to really be checking in a really sensitive way, maybe at sort of a regular time, rather than pressuring or kind of trying to force anybody to talk about what happened, and really normalising the fact that we don't want to talk about things that have happened that feel painful, and that's one of the most common reactions to events like this, but letting your child know that you are available to talk about what happened if and when they want to.
And just to add to that as well, sorry, Natalie, I know it's hard going back and forward with this. You know, your child might also be asked a lot from others, you know, about how they're feeling and what's happened, being a shared trauma, and especially if they were at the lake at the time, there might be a lot of people who are asking a lot of questions, and they might not want to, because, you know, it is so normal to not want to talk about it right now as well. So just, I suppose, just to really stress, avoidance is the kind of norm. So but also avoidance can make things worse. So I would say, you know, just maybe help your child think about how to respond to that if they don't want to say that. Just say, you know, for example, I don't want to talk about that right now. Is that okay? You know, just kind of if there's a line like that that might be appropriate if they don't want to kind of share everything lots of times repetitively. And, you know, for some of those children, I know lots of children are going to the lake, but for some children, that might be quite triggering as well, going to the lake, because of you know, the experience they had. It could also help potentially in time, but just kind of being mindful again, there'll be different reactions with that. Back to you, Sarah.
So kind of linking in with what we've just said, as a similar theme coming up is how to respond to questions specifically about what happened. So obviously Jess has just been saying that we can support young people to name if they don't want to talk about it. This has been coming up a bit in terms of just like kind of the factual details of what happened. And I guess there is a police investigation ongoing. A lot of uncertainty remains, and we don't know the full details. So that's a very difficult uncertainty to manage. But for now, that is a response, that we do not have the answers at the moment.
And it can be really hard sitting with that uncertainty. And I think, again, it's just encouraging your child to be able to sit with that, you know, we're not going to be able to necessarily work out all that details. We might never know, or we might know, but it's about kind of, it's about being able to talk about it and even name that that's really hard sitting with it. But unfortunately, there is uncertainty here, and we can't make that go away. These are difficult feelings for them to go through, and I think most parents would want a magic wand to take that away from their child, and we can't do that. You know, they have to experience these things, and they will get through it. It's going to be really tough.
Some parents are finding that their child is talking to their friends about what happened, but really isn't wanting to talk to them. So I think we've covered sort of making time and making sure your child knows that you are available to talk to them. It's really common and very often overlooked just how much young people very typically will value their friends and their friendships a bit more than their relationships with their caregivers, particularly at this age. And so it's really normal and understandable that young people might be wanting to talk to their friends about it a bit more. And just, I think, as we've said, that kind of idea of not pressuring them to speak, but letting them know that you're there is what we can do at the moment.
Yeah, I agree. Just, yeah, giving them space that you know, but you really aren't forcing them. And I think if they are talking to their friends, that's a positive thing. And that's, of course, not uncommon that a child might prefer to do that, but it's still making that space available. Any feelings that they do have, just validating that. But you know, absolutely, if they're wanting to talk more to their friends, that is okay.
We have had a couple of questions around other types of avoidance. So some young people not wanting to leave the house as much as they did beforehand, certainly not wanting to go back to the park since, and parents wanting to know if this is normal.
So not wanting to leave the house and not wanting to go to the park, very normal, very, very normal. I mean, it's extremely common. I think to go back to the place where it happened, even if they weren't there at the time, I think is so triggering for people who were there. There would have been a lot of sounds, a lot of sensory experiences, what they saw, what they heard, maybe even smells at the time, thoughts, feelings. But for those who weren't there, just knowing it happened there would also be enough to want to avoid it. So I think for everyone, it's not surprising if they would want to avoid that. And I wouldn't push them into doing that at all at this point. I think that if they don't want to do that, I think in time they might, and that might be helpful in time. But I think at this point in time, that's okay to just really respect that. I know some children want to go, and again, this just speaks to the fact that people react in different ways, and it's all okay. But yeah, sorry, I've lost my train of thought, Sarah, for a second. So there was another part to that question, wasn't there?
So there was the avoidance of going back to the park, avoidance.
Oh yes, and going out.
Yeah.
Yes, I remember now. So going out is a difficult one because again, it's a lot of teenagers don't want to leave the house anyway in the holidays, do they? Particularly lying in bed a lot. But it doesn't have to be a lot, but I would be encouraging, even if it's just, going out very briefly. I think the problem is these things can grow a little bit. Obviously, I realise there's only another week, and then kids are back to school, and so it's a different kind of time. So it's really getting that balance of kind of just, there's not a right answer here. If you feel your child just needs a couple of days just to kind of to be on the road, that's fine. This is more of a problem if it goes on and on and on, of course. But these are normal experiences at this point to want to withdraw and wanting to avoid. Normal.
We have had some questions about whether or not to encourage revising for GCSEs. So I think Jess covered this in the slides in terms of how important it is to try to keep to maintaining routine, and that it will be important to encourage those who are revising for GCSEs to try to be doing some revision, whilst also really normalising that of course they feel distracted by what's happened, of course they're struggling with the emotional impact of what happened, and there will be a select few who really are finding that they're unable to revise. But that we should still definitely be encouraging them to do what they had planned to be doing in this break and what they were expected to be doing.
Yeah, just regular breaks, and just understanding, really finding the best way for them to revise, the optimal times in the day. Yeah, I think that's the best thing we can say really around this. But we would be saying yes, on the whole, for most children, it's a critical time, we know, in terms of their exams, and so those routines are going to be important. If they're not doing that, they're probably likely just to be on social media, and that's not going to be more helpful.
We had a bit of a theme coming up about guilt,
Mm-hmm.
and not wanting the children to be feeling guilty, not wanting anyone to feel guilty, but recognising that actually a lot of young people are feeling guilty about what happened, particularly those who were meant to be there but weren't, those who were there and observed what happened but couldn't help, and others who were more kind of directly involved in what happened and tried to help but could not save Isaiah, and just how to really help those who are feeling guilty. I think that there will be information shared with young people in terms of some of these normal responses to a traumatic event that Jess has gone through today. But certainly it would be incredibly important to just really normalise feeling guilty, even when we're absolutely not to blame for what happened. It's a really unfortunate outcome of experiencing something traumatic. It's very common in particular to have these thoughts of I should have, or I could have, if only I, or I would have. And hindsight bias is just one of those really unfortunate things that we are all likely to experience after something like this, that kind of idea of what you could have done but didn't do, and that actually we need to remind young people that we acted based on the information that we have at the time of the trauma. And not only that, but when we're experiencing something traumatic, we are biologically programmed to go into a threat response whereby we are automatically reacting in the way that we react. And that can often be that our bodies and our minds are reacting in a way that's programmed to keep us safe as well, knowing this is a dangerous situation. And that often can be the reaction for why, of course, other young people didn't jump into the water to try to save him, although might, in hindsight, be wishing that they did. It would not have resulted necessarily in somebody being saved. So that's the sort of thing I want to help young people to understand, that it's very normal to be feeling guilty, but that these shoulds and woulds and coulds are an aftermath of something traumatic happening, and if those shoulds and woulds and coulds could have been fulfilled, it wouldn't necessarily result in Isaiah's life being saved.
And I think also, just to add, thank you, Sarah, is for parents though, when a child is saying that they feel guilty or bad or responsible, don't tell them you're not, you know, don't be silly. Again, they're real feelings they've got, and so validate that, you know, I can hear that you feel that way. That must be really difficult for you to have those feelings, and then maybe explore it with them a little bit. You know, what do you think would have happened if that had happened? How do you know that would have happened? And just helping kind of coming to that more balanced view, but validate those feelings, because you telling them that they shouldn't have those feelings doesn't make it go away. They are normal. They're normal things that a lot of the kids might be feeling right now, and you know, validate that and hear them. Doesn't mean that you think they're responsible, of course. You know, that's you know, not the case, but or maybe, you know, maybe you do, you know, that there's also a possibility as parents that you might have those feelings that come up for yourself, or maybe they were a bit responsible. And again, obviously that's not something you're saying to your child, I hope, but it might be something that you need to talk to someone else about, and in a safe space, because again, these are normal things.
Okay, I'm sure it's not surprising that social media is being mentioned. So certainly some worry around not being able to kind of monitor what young people are watching or seeing or talking about on social media. There's a worry that there can be some misinformation on social media. There's worry around kind of not feeling connected to what the children are watching, and how to really manage that.
I mean, it's the ultimate tough question in life, isn't it, that one? How does a parent manage that? There's no easy answer, is there really? Obviously, you know, some parents choose to limit their child's phone usage. I know that doesn't and isn't possible for all parents, and an easy thing to do. I know some parents do monitor what might be on the child's phone. I know at 15, 16, that's an extremely hard thing to do as well. So I think the main way is, you know, other than, you know, if you choose to kind of really check content and limit phone usage, which, you know, is a reasonable response to take, and in some situations we would suggest. But I think, you know, it might be that your main approach is just to have really transparent conversations with your child about that, about your concerns about that. We know that the more someone is reading something, it was the same during COVID, that, you know, the more people were kind of reading content about it, the more anxious you might get. Not surprising, is it, that the more you're kind of taking in kind of maybe things, you know, other traumas that were similar, or things that come up, it's going to affect how you feel. You're going to feel a lot less safe. And you know, unfortunately, phones do work in a way that then you just get more and more of that content. So I think this won't be new to young people, but it's about having conversations. It might be that you want to have conversations with other parents you know and their children together collectively a little bit about this. You might want to kind of have some agreements about it, but there's not an easy answer to this. I think the main thing is just really talking to your child about the impact and what that might mean for them. I wish there was a I wish there was a kind of more magical answer to that one, though. Obviously, I'd like it for myself too.
We've had a couple of questions with a bit of a theme around some young people feeling, kind of going back to guilt here, but some young people feeling guilty for struggling, despite not necessarily personally knowing Isaiah.
Yeah.
Hearing about what's happened.
Yeah.
So we wanted to just kind of address that.
Yeah, and again, just to really reinforce that is normal. I think it's really often the case that people feel guilty about that. Why do I feel so sad? Why is this affecting me so much? And, you know, as we said at the beginning, traumas affect us all differently for lots of different reasons. We might have our own historical, you know, other experiences in our life that might impact when you then have a trauma that impact on that. So that, you know, there's lots of reasons why we might also kind of respond a certain way, or you might have nothing. There might not be anything else, but this has really affected you, and that's okay. I mean, it's I think the difficulty is for young people then that there might be some judgment, perhaps from peers, thinking they're judging me, that I didn't know that person very well, and why am I responding in this way? There's not an easy way around that, other than to say these are normal experiences that people have. So for you as a parent, just to validate your child that it's okay they feel that way. You know, even if you didn't know him, you were part of this community, you've been part of this experience. It was shocking, it was scary. It's understandable you'd be affected, and you know, and ask them to talk to you if they're feeling that people are saying anything negatively about that. And maybe that could be reinforced as a school as well, that, you know, there will be all sorts of kind of different reactions, and people may not have known Isaiah well and still be feeling upset.
And then probably just for time, and also I think we have covered most themes, but one final theme maybe to think about is that some parents are noticing the frequency at which their children are going back to the park has really kind of ramped up, but not just the frequency, but also kind of the emotions that they're expressing when they come back, even almost like a sense of kind of euphoria from having been at the site. And do we have any thoughts about that?
Yeah, we do. It's a really tricky one, I think, here, because again, that sense of being in control, you want children to have choice, don't you, and to be empowered, and you know, there's that collective kind of feeling of wanting to come together and be connected with each other, and so, you know, as a parent, you want to enable that. I think that the repetitive going back to the park is unlikely to be helpful. I think that there's a contagion effect that can happen as well, I think, within a big group, and some of those some young people will be having, you know, particular feelings, and then everyone there will feel like they've got to, it can be a very contagious kind of feeling, almost a bit of a high, and not to say they shouldn't do it, because, you know, again, for some children going back to that site is going to be really important. They're really remembering Isaiah, and there's not an easy answer here. I think it's going to be triggering for some children, and if they don't want to, that's a good thing potentially. I think for children that keep wanting to go back, I think I would just talk to them about that. What is it they're wanting to do? Is there another way they can be connected? Is there another way they can kind of be together? And it's not that it's wrong or necessarily harmful, but there is something about that experience that can hype everyone up a little, sometimes in an emotionally unhelpful way. So I think it's I think as a parent to have a line of don't do that is a bit strong, because I think you want to give them choice, but I think you want to kind of talk to them about what's happening. My feeling is that it will just kind of stop happening soon anyway, that, you know, I think it's very early days, and I think it's very likely that, you know, as time goes on, that's something, you know, maybe less and less children will do. So I think it's probably not something to be overly concerned about, because I think, you know, it's at the moment they're just wanting to really be together, and they haven't got the school structure either, have they, being not at school. So this may well change. It's something to keep an eye on, and I would keep an eye on how your child is kind of responding afterwards, whether it's making their symptoms worse or better. But it's not right or wrong, but I think you need to think for your child, is this helping them? think we're pretty much at the end, aren't we? Was that it, Sarah?
Yeah, I think they're the main themes. A couple of themes were around asking for support, and I know that I think we've published the email address for contacting school about in-school support, and there are a couple of other resources on there that have been published as well, the talkgrief.org.
Great, thank you. Should I hand back to you, Dan?
I'll come in there. Yeah, thank you very much, both of you. All to the whole team. Thank you very much, Sarah and Jessica, for fielding all the questions. I just wanted to come in on that point about support in the school. There will be somebody available throughout the Easter holiday. So over the course of the 2 weeks, there'll be counsellors, mentors, and a senior leader on site every single day throughout the Easter period, except with the exception of Saturdays and Sundays, I should say. We'll also be emailing all the students with further support sources of support. If they would like to access anything further. So we'll be talking to them about what we're doing in school and how we can support them further. I'd just like to remind both parents and students that we do have the Book of Condolences available. That's in CR3, so parents can access that pretty much any time by going to the small premises reception, or indeed if they go to the main reception, there should be somebody there to let them through for that. And I just wanted to let parents and reassure parents that the documents and the strategies that Jessica and Sarah have shared with us today from the UK Trauma Council, that has informed the school's approach throughout the whole time and our whole response. So that whole sense of being safe, calm, connected, in control and hopeful has been at the heart of our response as well. Just before I hand back to Andy Sear, I want to mention one final thing, which was about the police investigation, which was referenced earlier on. And I really wanted to stress to parents that police investigation is to try to piece together what has actually happened. So the police are not investigating it in terms of in order to apportion blame. And it's just they want to inform the coroner's report. It's not they're not looking at, as I say, to apportion any sort of blame. And now I'll hand back to Andy Sear.
Thank you, Dan. And I just wanted to again thank our guests for coming in today. We really do appreciate your support. Just a couple of things I would mention in addition to what Mr. Harding has outlined today. We are joined today by Mr. Wilson and Mrs. Boyd. Mrs. Boyd is actually currently in Barcelona on a school trip. And she has asked me to communicate to you that in relation to some of the parents being a bit concerned about the park, as sort of Jess and the team have alluded to in the questions and answers today, the school is able to speak to the young people as well. And Mrs. Boyd is very happy to if you are concerned about anything, you can contact Mrs. Boyd or Mr. Wilson. And of course, sometimes if it comes from somebody else, we are validating how they feel, of course, as Jess has said, but we are able to speak to them in a way a parent can't speak to them. So we're happy to take on that and have those conversations with them if you would like. And Mrs. Boyd has asked me to say to you that if you want to reach out to her via the support email, then she'd be happy to sort of take that forward for you. The other thing I would mention is that we invited all parents today to this webinar because we realise that this shared trauma and loss will cut across all different year groups, not just obviously year 11. And so we'll be doing things with the years when we will come back to school from the 23rd. So we will be doing work in each of the year groups with the sort of partners as we've got today, but partners sort of across the different agencies, just to reach out to the children and try to support them as they return to school. And of course, we recognise that some students may not actually know what's happened yet. And of course, we need to be mindful to that. And that will be something we'll be sort of doing as they come back to school. And with year 11 particularly in mind, we are listening very much to what the students are saying to us at the moment about how they would like to commemorate and celebrate Isaiah when they come back to school. We will put that out to you in a separate briefing shortly when we've got all of those ideas kind of coalesced, but certainly the bench and the tree and all the things that are being suggested are all perfectly viable suggestions, and we are listening very much to our students. And as Mr. Harding has said, they can leave flowers and they can in room CR3 where the condolence books are. So there is a place at school that they can come to, and we'll share with you a bit more about how Mr. Wilson and the team are thinking of running a commemoration assembly, most likely on the afternoon of the inset day, which is the 22nd, which is before they return to school officially on the Wednesday, but we'll communicate that to you a bit more. Mr. Wilson, I don't know if you wanted to say anything at this point. I'm aware you're here, and it would be if there's anything you wanted to say.
I don't have anything to say.
Okay. I will just reiterate on Mr. Wilson's behalf, and also for Miss Boyd, I know who wanted to both say this, that they are very appreciative. The whole team are appreciative of all the support they received from parents and the whole school community, and I know that they are dealing with a very difficult time at the moment. So obviously we are looking after them and making sure that they are getting the support that they need as well. Okay, I think it's all I need to say now, so I'll hand back to Mr. Harding, who I think will conclude the session. And thank you very much for attending today. Mr. Harding?
Yes, all I wanted to say is, this is part of, we always have parent forums. It's just very rare that we have parent forums in such tragic circumstances, but we're immensely grateful to have real experts in the field who've been able to inform the whole conversation around this, the trauma that we're feeling as a school community today. So a debt of gratitude to you, Jess and Sarah, for coming here, and Susie for being with us this afternoon. We're very grateful to you, and thank you for helping the parents through this very difficult time.